This video is based on a case study, how a CKD patient went back from advanced stage 4 to stage 2 in just 3 months by taking 1 vitamin and 2 supplements. Catherine here. Today's video is going to be about a case study published by a scientist, Dr. Stephen McConnell. He wrote this article about his father. Yes, the patient in this case study is the father of the author. I will refer to the patient as RM during this video. RM was rapidly approaching end-stage renal disease. He was in stage 4 when he was told to prepare for dialysis, but he never actually ended up in dialysis. The reason is that his son is a scientist and he decided to take action and to give his father a combination of 2 supplements and a vitamin. The result obtained with this intervention went beyond any expectation. In this case study, kidney disease was not just reversed. RM was able to gain back a huge portion of his kidney function at the point that, at the time of the publishing of this case study, he was back in stage 2. Here's what the author writes. This approach worked amazingly well for my father because he reversed his CKD by more than 2 stages. He was nearing end-stage renal disease or stage 5 and he reverted back to stage 2, which was a virtual miracle at the time. And guys, the reason why I'm talking about this today is because I believe that what the author of this study says is true. In particular, the author is convinced that the very simple intervention he tested on his father could work on many kidney disease patients and that it can help them avoiding dialysis. Today, I want to examine what he did and I want to share with you how you can apply these findings and use them to protect your kidneys. So question, what did the author of the study use to reverse kidney disease in his father? In this article, the supplements and medications used are very well outlined, which is great for us since we can learn a lot from what the author discovered. As I was saying, the main treatment that saved RM, the CKD stage 4 patient, from dialysis is a single vitamin that his son administered him in high doses. More about this in the next part of the video, because you see, the vitamin was not the only treatment. There are 2 other supplements that were key to his huge improvement. While I, Stephen McConnell, was learning lipidology in the period between 2002 to 2007, my father suddenly went to the ER late one Sunday night and my mother called me hysterically. I took your father to the ER and now they are scheduling him for placement for stents. I was concerned. My father was 81 at the time and he had been jumping rope for 30 minutes twice daily. His body had a deceptively healthy look and his triglycerides were low. But when we put it all together, he was pattern B, insulin resistant. On New Year's Day, about 6 months after his MI and stent placement procedure, I received a call from my mother. Your father is in the hospital. They're going to have to do open heart surgery. To recap, RM, who was 81, was in stage 4 of kidney disease, close to dialysis, and he was also suffering from heart disease, dyslipidemia, and prediabetes. And he also underwent open heart surgery prior to his diagnosis of chronic kidney disease. It was after the surgery that it was discovered that RM had kidney disease and that he was in stage 4. Here's what the author of the study says about this. Later in the spring, they returned home. The physician said, "Hey, I got some bad news for you. Your dad has renal insufficiency." I said, "Oh my God, he's in renal failure. What stage is he?" He did not know. That was a flag. Most clinicians don't know what stage their CKD patients are because the lab doesn't do calculations and the creatinine measure is not reliable or accurate. At the time, I only knew he was in failure, but when I did the GFR calculation, I could see that he was well into the latter portion of CKD stage 4. But guys, even if the conditions of RM seemed dire, his son was able to find a treatment that worked. He is back in stage 2 now. Now, RM being in stage 4, the primary focus of the treatment was to control phosphorus levels because, as the author of the study says, excessive phosphorus is toxic to the kidneys as well as virtually every organ system in the entire body. And he's obviously not the only one saying that. Current medical literature basically tells us that managing phosphorus correctly is key to help you keep and improve your GFR and other key markers of kidney health as well. In fact, studies are linking higher serum phosphate levels to muscle cramps, bone and joint problems, but also heart attacks and strokes. Patients with higher phosphorus levels are known to suffer from a higher mortality rate. Phosphorus is the main reason why dairy products are not recommended for people with kidney disease, and also part of the reason why meat and fish and other protein sources are also banned. Now, this is very important. Controlling phosphorus levels was key in this case study for the huge improvement in kidney function obtained. But today, a lot changed about the way phosphorus intake is managed, and many CKD patients are confused. Up to just a few years ago, phosphorus intake was restricted by simply limiting high phosphorus foods such as meat, dairy, and foods containing phosphates. And this is still useful, but what is recommended today is to keep blood phosphorus level in the right range, which is 2.5 to 4.5 milligrams per dl, and not to just restrict phosphorus intake in the diet. What this means is that you should make sure you are being tested for phosphorus levels. Alright, even if you're just in stage 3, your diet and treatment should be based on this level. And since RM's levels were not low enough, the author of the study decided to intervene on that, which was key to RM's improvement. One of the treatments was the high-dose vitamin that we will see next, and also calcium carbonate. As we can see, RM is taking 2 to 4 grams of calcium carbonate antacid tablets, usually sold as Tums. With his main meals, that's a total of 400 to 1000 milligrams elemental calcium per day. Now, calcium carbonate is often used in kidney disease patients, and it's something I recommended in the past for those with too high phosphorus levels. Taking calcium carbonate with meals is helpful because it sticks to the phosphorus in the foods you eat. The phosphorus is then removed through the bowel, effectively stopping your body from taking extra phosphorus in. There is an added benefit here, which is getting more calcium. But the main benefit is protecting your cardiovascular system and your kidneys from the dangers of excess phosphorus. This is a huge step in the direction of an improvement. Now guys, if you are not keeping track of your phosphorus levels yet, or if you want to learn more about this topic, my video up here, notes down description is for you. Back to RM's case study. Now, controlling phosphorus is key to improve with CKD, but it's not enough. In order for RM to achieve his huge improvement from stage 4 close to dialysis to stage 2, another common complication of CKD needed to be taken care of. I'm talking about metabolic acidosis. Metabolic acidosis is even more common than hyperphosphatemia in those with kidney disease stage 4. It affects around 40% of patients. Metabolic acidosis happens when there is too much acidity in the body for the kidneys to adequately balance it. It's one of the main causes of kidney damage. Metabolic acidosis causes fibrosis in the kidneys or scarring, but it also damages many other organs in the body, including heart and bones. It can cause symptoms such as confusion, headache, nausea, and weakness. It's fair to say that anyone with kidney disease should focus on controlling their body acidity. What we generally do about that is following an alkaline diet. You know, limiting foods high in protein, but also meat, cheese, processed grains, sweet, soft drinks, and junk foods in general is key for kidney health because it helps controlling body acidity. But in the case of RM, another supplement was used to control this issue. I'm talking about sodium bicarbonate. RM is taking 1.8 grams a day of sodium bicarbonate, 1/3 at lunch and 2/3 at dinner. Now, while sodium bicarbonate is also commonly used in people with CKD, I don't necessarily recommend taking it with meals. Many people find it more tolerable to take it before meals or away from them. And also, finding the right dose for sodium bicarbonate is something that must be done based on blood tests. So while I think that many patients would benefit from taking this supplement, I still recommend getting informed about it. I've talked more in depth about this in my video up here and also down in the description. Now guys, as I was saying, the most important part of RM treatment was the vitamin. Let's see now what vitamin Dr. Stephen McConnell, the scientist behind this incredible success story, prescribed his father RM in order to get him back in stage 2 from stage 4. Here's what he says about it. I have now personally observed more than 25 documented cases of individuals having their CKD progression not only halted but reversed with the addition of 3 to 5 cents worth of niacin per day. So the vitamin he used is immediate release niacin, a natural form of vitamin B3. Which is amazing. And guys, as I was saying, I believe that he could be right about this niacin-based treatment. But keep in mind that high-dose niacin is not an approved treatment for CKD stage 4, okay? So while both sodium bicarbonate and calcium carbonate are frequently used and effective, this vitamin in the dose the author of this paper prescribed his father is something new, still relatively untested. So watch the video until the end and consult your doctor before even thinking about increasing your daily dose of vitamin B3, alright? Now in this study, Dr. Stephen McConnell says that what he is giving his father is a low-dose niacin treatment. However, I think that calling that a low dose is a little bit misleading because what RM is taking is a lot more than the daily value for this vitamin. More about the dose in a moment. Before, a very important question. How can niacin be the key to reverse stage 4 kidney disease? Niacin is a powerful form of vitamin B3 and it's very beneficial for your kidneys, says science. Many studies show niacin can lower high cholesterol levels, protecting your heart and kidneys. And today, science is starting to support the use of niacin as a way to protect the kidneys. A review of studies published on the American Journal of Kidney Diseases concluded that niacin has a favorable impact on multiple risk factors affecting the rate of GFR decline, such as HDL concentration and function, triglyceride level, oxidant stress, inflammatory markers, endothelial function, and serum phosphorus levels. The authors of this meta-analysis published on AJKD believe that niacin may seriously decrease all-cause mortality in people with kidney disease. And this is nothing new, by the way. Today, CKD patients are usually recommended to supplement all B vitamins, niacin included. Now, phosphorus control is one of the main reasons why niacin is so helpful for CKD patients. As we have seen, controlling phosphorus is key to protect the kidneys. Another reason is the property of niacin of protecting the kidneys from acute kidney injury, which seems to be especially important for cardiac bypass surgery patients like RM. And while niacin is also naturally found in many foods like leafy greens, quinoa, muesli, white rice, and corn on the cob, the dose that RM is being given is pretty high compared to what you could get from the diet alone. So question, what dose niacin was used here? While the author doesn't specify what dose his father is receiving, he outlines a range of doses supported by several studies. In particular, 100 to 500 milligrams of immediate release niacin 1 to 3 times a day is what he recommends. And while he calls it low dose, keep in mind that doctors recommend periodic liver function tests when taking 100 milligrams per day of niacin or more. In fact, if you are taking a renal multivitamin, you are probably receiving just around 20 milligrams a day of niacin. So as I was saying, consult your doctor if you think a higher dose could benefit you. And guys, if you want to watch more success stories like this one, my video up here is for you. And this is all for today. Thank you for watching. See you on Sunday.